Two medical advisors for the Department of Homeland Security are urging the U.S. government to expand its COVID-19 vaccinations and mitigation efforts in immigration detention centers across the U.S. The call to action was disclosed in a whistleblower complaint exclusively obtained by CBS News. According to government statistics, coronavirus infections have surged in ICE detention centers by more than 800% since the start of the new year. In a newly published article, CBS News explores the devastating impact COVID-19 is having on the nation's ICE facilities and what the whistleblowers are requesting from the government in order to slow down the spread of COVID-19. CBS News immigration reporter Camilo Montoya-Galvez joins us now. Camilo, it's good to see you. Tell me now, what is contributing to this rapid rise in COVID cases in ICE detention across the U.S., and what are these two doctors saying on this disclosure?
Hi, Lilia, that's right. ICE is currently isolating or monitoring more than 2,600 detainees due to confirmed COVID-19 infections. That is 12% of ICE's current detainee population, which stands just below 22,000 as of this week. So that is a significant percentage of ICE's detainee population. We know that this is also the largest system-wide coronavirus outbreak inside ICE's sprawling detention network since the start of the pandemic. And this surge in coronavirus cases has renewed concerns from public health experts, advocates, and the department's own medical advisors. These two doctors who inspect immigration detention facilities on behalf of DHS Civil Rights Office said that the agency is not doing enough to protect detainees and workers at these detention centers. The doctors are urging Secretary of Homeland Security Alejandro Mayorkas to ramp up COVID-19 vaccination, to provide more protective equipment such as face masks to detainees, and to expand access to booster shots for detainees. We know that as of earlier this month, fewer than 700 ICE detainees had received a COVID-19 booster shot. These doctors say that that is unacceptable and that more detainees should be getting these booster shots to protect them from the rapid spread of the coronavirus inside ICE detention.
You know, Camilo, I've talked to people on the other side of the border who say that there's a lot of organizations in some of the camps where migrants are, assembling before they make their trip, or people who've been sent back either under Title 42 or with MPP, which has now been expanded. And it seems like there's a lot of people who are getting COVID there and then crossing the border. What's DHS saying about the complaint, and what measures is the agency saying or taking to better the situation within the facilities once people are here in ICE detention?
Yeah, well, the Department of Homeland Security has not responded to a request to comment on this new whistleblower complaint by two of its medical consultants, but ICE, the agency that detains these migrants, has previously said that it has robust protocols in place to enforce COVID-19 mitigation protocols, and that it is testing all detainees at intake. It is also noted that the rate of vaccination among detainees has increased substantially since last summer, when ICE received its first federal allocation of vaccine doses. The agency has also highlighted the fact that it has been releasing some medically vulnerable detainees due to an ongoing federal court order in California and its own internal policies. But advocates for immigrants, however, would argue that the agency should be releasing more medically vulnerable detainees, should be addressing a 37% vaccine refusal rate among ICE detainees, and should be reducing the number of facility-to-facility transfers to try to mitigate the spread of the coronavirus. And you mentioned the situation at the U.S.-Mexico border, Lydia, and I can tell you that the vast majority of the immigrants currently in ICE detention were transferred from U.S. border custody, and we know that Customs and Border Protection is not offering vaccines to most migrants.
That's interesting. I mean, to me, it was alarming, Camilo, to hear that it is, nonprofits and others on the other side of the border who are trying to struggle to protect people who have been in detention here already. Camilo, thank you so much for joining us. It's good seeing you always.
Thanks, Lydia.